Hi all, welcome to the class of BLS. BLS, Basic Life Support. It's an important aspect for every people to know about BLS. So it's not only for the medical professionals, it is actually everyone has to know about the BLS. What is the purpose of knowing BLS? BLS is very important to rescue a life-fit person. It is very important in the sense that if a person is going a life-threatening condition, you can rescue the subject by knowing that thing known as basic life support. So what is the order of sequence of order in basic life support? It is CAB. Earlier it was ABs. So every 5 years the AHA guidelines will be changing. So the latest guidelines, according to the latest guideline, it is CAB. C for circulation, A for airway, and B for breathing. CAB. So how many compressions? What is the sequence of doing? So I just tell about the sequence how to do. So first you have to see for the scene safety. When you see a subject in a outside area or wherever it is, you have to see for the scene safety, verify for the scene safety. Second is checking the responsiveness of the subject. The response of the subject is there or no. Third, if there is unresponsiveness, you have to shout for help and you have to tell to activate the emergency response system and get an AED. AED is nothing but automated external defibrillator. And then check for simultaneously you have to look for breathing as well and check for the pulse at least more than 10 seconds. It has to be less than 10 seconds. So you can count 1 in 1000, 2 in 1000, 3 in 1000, 4 in 1000, 5 in 1000, 6 in 1000. If there is no pulse, and where you have to look for the pulse, it is the carotid pulse. If the pulse is absent, if it is pulseless, you have to start immediately with the compression. So how many compressions you give? It is 30 compressions and 2 breaths. So 30 is to 2 is our ratio in adults, 30 compressions and 2 breaths, and this has to be repeated 5 times. Means in every 2 minutes, this is a cycle of 5 times. It has to be cycle, a cycle means 30 is to 2, so 5 cycles in every 2 minutes has to be done. So after every 2 minutes you will be looking for the pulse. The pulse is known, then again you will be continuing the CPR, and there is an other sector known as acls after that. So our BLS is actually from the scene safety, then we are seeing for the responsiveness, simultaneously breathing has to be checked, and then you are activating, asking for the activation of the emergency response system and getting an AED, and then checking for the pulse. Again, in between it has to be less than 10 seconds and going for the compression if it is pulseless. Compression 30 is to 2 breaths. So I just show the demo how it is. First, check for the scene safety. Okay, the scene is safe and tap and see whether there is responsive or non-responsiveness. Okay, then shout for help, help, help. Activate the emergency response system and get an AED. Look for the pulse. 1 in 1000, 2 in 1000, 3 in 1000, 4 in 1000, 5 in 1000, 6 in 1000. No pulse. Go start the CPR. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So after the compressions, the ambu bag is placed with the mask or the mouthpiece is there, mouth mask, it is placed, and there's a C-shaped scene is given here in the C model, and E to just lift the chin, and then you are giving 2 breaths. You can see now clearly the chest. You just see the chest. 1, 2. So this is the complete procedure. I'll just show the thing without telling anything. Just show the steps again once more. So first, scene safe, see for the scene safety. Scene is safe. Are you okay? Help. Activate the emergency response system and get an AED. 1 in 1000, 2 in 1000, 3 in 1000, 4 in 1000, 5 in 1000, 6 in 1000. There is no pulse. Starting with CPR. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. This is one particular cycle. So this similar way you have to follow 5 cycles in 2 minutes. Okay. That's about BLS. So how much should be the compression here? The compression should be, the quality of CPR is very important to know. The compression should be at least 2 inches deep, and the compression should be 100 to 120 compressions per minute. So in 1 minute at least it has to be 100 to 120 compressions. That means in 1 second 2 compressions is the normal time. So it is in case of adults. Whereas in infants it is 15 is to 2. In pediatrics it is 15 is to 2. It is in the brachial pulse, not the carotid pulse. So this is all about BLS. Verify the scene safe. Scene safety should be looked. Responsiveness or not. If not responsiveness, shout for help. get the activate emergency response system and get an AED. Activate emergency response system in the hospital, it is code blue. You can tell it's code blue, activate code blue. Okay. Whereas outside you have to go for the ask the subject or ask a person to help you by calling an ambulance or to assist you. Okay. Activate the emergency response system and get an AED. AED is nothing but automatic external defibrillator. Then look for the pulse. Simultaneously breathing has to be assessed. Not more than 10 seconds. It should be, the pulse has to be counted in less than 10 seconds. Where you look the pulse, it is the carotid pulse. Then you will be starting compression if there is no pulse. 30:2, 2 breaths is given. And once the AED arrives, you have to follow the AED instruction. If you connect the AED, it itself gives instructions. So based on that, you can follow. What are the things that you should look carefully for the quality of CPR? To get a high quality of CPR, to do a high quality of CPR, you have to look certain things. So first, the heel of the hand, it should be at the lower level of the chest. You can see here, the lower level of the chest, the hand should be, the heel should be placed there. Okay. And the movement should not be from the elbow or the shoulder. It has to be from the back. So I just show the compressions. It has to be, the heel has to be at the lower level of the chest, and the movement should be from the back. Not like you are doing like this. Okay. You cannot flex the elbow from the shoulder. So it has to from the back. Okay. It has to be from the back. So what about the compression depthness? The compression should be at least 2 inches deep, and there should be a proper recoiling after the compression. So you cannot give a compression without recoiling like this. It's not completely going inside or it's not recoiling completely back. So that's not a high quality CPR. And there should not be any interruptions between the CPR. Okay, in a hospital we can have a team of 6 or 7. A team leader will be there, a person for compression and a person for breathing, a nurse will be there, a timekeeper will be there, a person defibrillator will be there. So these things are the hospital. But generally in an outside condition, only 1 or 2 person, they cannot do everything, but at least they can really concentrate on the CPR and the breathing. So they can simultaneously take a turn. So in hospital setup it is okay. They have a team is formed. Simultaneously when the person is getting tired, it can affect the quality of CPR. So he has to change his role. So that has to be taken care. The compression should be 30 and similarly 2 breaths. And there should not be time wasted in between. So interruption can affect the quality of CPR. And the compression rate should be 100 to 120 compressions per minute. Not more, not less than 100, not more than 120. Okay. So at least 2 inches should be the depth of the compression. That is a part of high quality CPR.